If you have mild to moderate acne, an acne cleanser can help to treat it. It can be used along with other acne treatments, but it's important to check with your doctor or pharmacist before combining different treatments. The main ingredient in acne cleanser is salicylic acid, which belongs to a group of drugs known as salicylates. When you apply salicylic acid to your skin, it can help to remove dead cells from the top layer of your skin and reduce redness and swelling. This can help to decrease the number of pimples and speed up the healing process. It's best to use acne cleanser as directed by your doctor or as indicated on the product label. Typically, it's used once or twice a day, and it's important to follow the instructions for the best results. When using acne cleanser, it's important to follow the directions on the product package. If you're unsure about anything, ask your doctor or pharmacist for guidance. Before using the acne cleanser for the first time, check if you're allergic to it by applying a small amount to a small area of acne for 3 days. If you have an allergic reaction, stop using the product immediately and seek medical help. If there's no allergic reaction, you can continue using the product. This medication is for use on the skin only. Avoid getting it in your eyes, nose, mouth, groin, or on any broken skin. If it does come into contact with these areas, flush with cool water for 15 minutes. If you're using a cream, lotion, solution, or gel, apply a thin film of the medication to the affected areas of your skin, usually 1 to 2 times a day as directed by your doctor. Before each application, wash the affected area with a mild cleanser and pat dry. Apply a small amount of medicine to the affected area and rub it in gently. If using pads, wash the affected skin with a mild cleanser, then pat dry. Wipe the pad gently onto the skin to apply the medication, usually 1 to 3 times a day as directed. Remember to wash your hands after use. If your acne cleanser contains salicylic acid, wet the affected area and gently rub the cleanser into the skin for 10 to 20 seconds. Do not scrub the skin. Work into a full lather, rinse thoroughly, and pat dry. If your skin becomes too dry, you may need to rinse off sooner or use the cleanser less often. Seek further advice from your doctor or pharmacist. The dosage of the acne cleanser is based on your medical condition and response to treatment. Do not use large amounts, apply the product more often, or use it for a longer period than directed. Doing so will not clear your condition faster, but it may increase the chance of side effects. If your condition persists or worsens, or if you suspect a serious medical problem, seek medical help immediately. If you experience skin reactions such as peeling, burning, dryness, or redness, especially at the beginning of treatment, you should consult your doctor or pharmacist. They may recommend using smaller amounts of the acne cleanser or using it less often. It's important to follow their guidance for best results. If your doctor has prescribed this medication for you, it means they have determined that the benefits outweigh the risk of side effects. Most people using this medication do not experience serious side effects. Although it's rare, a very serious allergic reaction to this drug can occur. If you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist for guidance. In the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this acne cleanser, it's important to discuss with your doctor or pharmacist if you have any allergies, especially to salicylic acid or nonsteroidal anti-inflammatory drugs, NSAIDs, like aspirin, ibuprofen, or naproxen. This product may contain inactive ingredients that could cause allergic reactions or other issues. If you have diabetes, poor circulation, or skin problems like infections, wounds, or atopic dermatitis, it's important to consult with your doctor or pharmacist before using this product. During pregnancy, you should only use this product if it's clearly needed. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, it's best to consult with your doctor before using this acne cleanser, as it's currently unknown if this medication passes into breast milk. When using an acne cleanser, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the best outcome for your acne treatment. If this acne cleanser is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember to keep this medication out of reach of children and pets to prevent accidental ingestion. If your doctor has prescribed this medication, it is important not to share it with others. If you forget to take a dose of the acne cleanser, take it as soon as you remember. However, if it's almost time for your next dose, then skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. When it comes to storing your acne cleanser, it's important to keep it at room temperature. Different brands may have specific storage needs, so always check the product package for instructions or ask your pharmacist for guidance. And remember to keep all medications out of reach of children and pets. When it comes time to discard your acne cleanser, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.